one of my key areas that I love to talk about and think about. What makes a good leader? So what, you mentioned her, so
Yes,
let's
I
use her as
would love to talk about.
let's talk about Ann. She'll be blushing when she hears this. But.
You know what I love about working with Ann as a leader is she is very, very sharp. She has her own style that is very soothing, and she uses humor to diffuse tense situations, and she does that so eloquently. But one of the reasons that I really enjoy working with her is because she really is a credible leader. She works hard to connect with people, with physicians, with all the leaders, the managers, the directors, with people in her community. She really starts early in the morning and she continues, late into the night, really connecting, with people. And I love that about her. She touches all our lives, and she shares, a true vision and goals in which we need to accomplish, and she helps us to get there.
So everyone, by sharing her vision, those that work for her understand what that vision is and how they fit into the plan. Yeah.
So as senior management team, we work hard on a strategic, vision and goals, and then we work with all our managers and directors and physicians to help us align our organizational goals, with their department goals. People work hard to try to achieve whatever they can do within their own department to help us achieve our organizational goals. And so everybody's working on the same, the same goals, same focus. And so Sutter is a very metric-driven organization. So, and quite honestly, the things that they measure are things that are of value to me.
They're not
personally.
Just numbers for numbers' sake. They're
quality of care, that's very important to people. They want to make sure that they have good quality of care when they come to Sutter Amador. We want to make sure that we provide that.
Now, and you mentioned during the break that that's part of what you're responsible for too?
In addition to being director of Ancillary Services, I'm also the patient experience champion. So, we want to...
I'm sure you get candid feedback too,
yes.
right?
And we want that. We
do.
want to hear the voice of our patient.
Right.
And, we always try to put our patient in the center, and we work around our patients. And in the old thinking, it was, we have to work around our schedules. We really try to work around our patients. And as patient experience champion, I work hard to try to let people know where we're at, where we need to be, and we work on gaps and eliminate some of those barriers on how to get
where
there.
the measurements don't maybe meet up, that you actually target that. It's telling you where to look and pay more attention.
Exactly.
So, it's interesting hearing you. You were talking about Ann, but you were actually describing leadership skills of what you do as well. And Marv, I know when we were talking earlier today about Ann, you said, I want to, say if she's amazing, I think you said. And how do you see her? Because you're not working for her, but you know her well. You work with her at Rotary too. What do you see as her skill sets that she brings to the table?
I think any leader, there's all different styles of leadership. You can be a bully and a tyrant, or my vision of a leader is you're a salesman, and you have to make people buy what you're selling. And I think she does that real well, because she lets you know how important it is to her and to Sutter Amador that things get done either by a deadline or a goal. And I know that
well, it sounds like she not only hears that desire, but also she walks the talk, right?
Well, yes. She does. And as I understand it, the morale at Sutter Amador is just sky high.
That's unusual, I would
think. It is, because you can't please everybody.
Yeah.
But that is one of the things that we measure as well, is employee satisfaction. It's called the culture of work. So, we work hard to try to have people that work at Sutter understand that what they do every day is really meaningful work. And
With all the changes that are going on, I mean, and your electronic health record is one good example, right? How does that impact the employee? So not, you are management, you're the leadership team, but what about all the staff below you? How does change impact them, and what do you need to do as leaders to help them?
I think we follow Ann's lead, which is sharing a vision of where we are going and why we're going there and why it's so important to our patients.
So helping them to understand the reason for the changes and the benefits to them
Exactly.
first, or what's in it for them.
So for the electronic health record, for instance, again, we need to share with our patients why we're doing this.
Yeah, definitely.
And again, it's really to achieve higher quality, safer care. So yes, I'm sure that, we're all in a transformational change. I think this is probably the third biggest transformational change since I've been at Sutter in 20 years. First was moving into the new hospital. The second
That's always
was,
a challenge.
opening up our outpatient building and all of that. This is a huge transformational change. And, you've got some really outstanding nurses who are scared about the technology piece behind it. And they're worried that they won't be a good nurse anymore. And so as senior leaders, we're doing a lot of rounding, and our leadership team is doing a lot of rounding to help people build confidence through this whole...
Yeah, because they know their old skills, but they don't have
Exactly.
confidence yet in their new
Right.
skills. Yeah. And, Mar, your organization is a little bit different because it's all volunteers. The foundation is all volunteers. You're president of the Rotary Club too, and that's
all
also
volunteers.
all volunteers. So how do you lead those organizations? What do you think are the qualities you need to bring to the table for that?
Well, I agree with Kim. You set out a vision and then try and get the people to see that vision and buy into it. I know this year our Rotary Club has achieved a lot of things. Not everything we set out to do, but we're well on our way to a lot of them. And, some people would say, oh, you're doing a great job as president. I'm not doing anything. I'm just saying, if we could do this, wouldn't it be great because we get this? And
Well, I think you are doing something. I think that you're facilitating that accomplishment. But so you had a vision when you started, and it sounds like you have one for your foundation as well.
we do. Every year it changes.
Yeah.
This year in particular, a lot of people on our foundation board, because we had achieved a goal of 150,000 2 or 3 years in a row, they said, you can only go to the well so many times, and we have such a giving community. But when the opportunity was laid out that we could get this cancer infusion suite, and then we got that very generous donation, we said, this is we got to do it this year. I mean,
It re-infused you guys with
it did.
passion.
We're very excited about it, and my opinion is, and I tell a lot of people this, I don't think there is a more important business in our community than Sutter Amador Hospital.
And why do you say that?
Well, what would we do if it wasn't there? And where would you go?
Out, away.
Yeah.
Or in many cases, I would imagine too, you may not even have coverage. It would force people away from the community.
When you or your family member have an urgent need, you really want to be in close proximity.
Yeah, my husband had a heart attack, and
Yeah.
whew, I was glad it was only, 30 minutes away.
We have got some wonderful initiatives going on in the hospital on patients, now we're stroke certified, so within 1 hour, when somebody presents with signs and symptoms of a stroke, we have all the systems in place to prevent further injury to that patient by getting the lab work, getting the diagnostic imaging results, having the physician be able to determine whether that person's really having a stroke or not, and give TPA within 1 hour.
I will
So-
say, when my husband went in, and I said, I think he's having a heart attack, it was amazing. It was just, I can't describe it, except he was surrounded and literally carried in and worked on immediately. It was, I was very amazed at the quality of care, and he ended up getting transferred to a different hospital, but it was very, very good care, and I was very pleased with it. So,
So that's why the importance of close proximity,
yeah.
because when it happens to you, you want to have it right there. So.
You sure do. So, well, we are fortunate to have Ann at the helm of Sutter Amador Hospital, and she's been there, my understanding, 10 years
10
as
years,
CEO. That's a long
yes.
time for
I
a CEO, so
know.
that's great. And we're going to take another quick break, give us a chance to share our sponsors. We'll be right back with leadership insights on leadership in life. Thanks.